Next question is Luann, who says, can this technology be used if one has joint implants? Absolutely, absolutely, absolutely. In fact, it better be used if you have joint implants. Right, I said better. It should be used. You should be using magnetic field therapy if you have a joint replacement. Why? The joint replacement is a foreign body. It's a metal. It's a material that does not belong in your body. Your body doesn't recognize it. It's not known to nature. It's not known to your body. And what happens when you have a foreign body? Have any of you have had a prick into your, like a needle or something sharp implanted in your tissues from the garden, and it develops a sore area, and it builds up and becomes really sore and knotted down, and then it becomes a thick area of chronic irritation? Well, that's because that needle, that little pearl, little object, little piece of dust, bone, whatever, a carbon molecule, gets stuck. The end of the tip of a lead pencil that gets dug deep into your tissues. That's there as a foreign body. Your body tries to wall it off because it's infecting it, it bothers it, and it causes inflammation. A joint replacement is inflammation. It causes inflammation. It's a foreign body. So if you've had a joint replacement, you should have been told, if you haven't been told, that any metal implanted into the body is a chronic irritant. And a chronic irritant then basically causes inflammation around it. And if you have a hip replacement or a knee replacement, that stem, that metal stem that's going down into your bone causes inflammation around that area, which then causes weakening of the bond between that metal and the body. The body doesn't accept it. The body doesn't grow itself into it, although we do call that osteointegration. So you get some degree of integration. So you should build up bone, strong bone build up around it to make it firm. But that doesn't happen because the body's trying to reject it. Magnetic field therapy causes osteointegration to be improved. It improves it. It accelerates it. It makes it more likely to happen. So there's a blog on my website about joint replacements and PEMFs. Very important blog to read. So if you have a joint replacement, you should be doing PEMF therapy for the rest of the time that you have that joint replacement, and which is going to be the rest of your life. You'll increase the lifespan of that replacement. So you won't have to have a redo or a revision surgery 10 years, 15 years later, right? Very important to use magnetic field therapy to preserve your replacement and to keep the tissues healthy. Also, it decreases, if you have inflammation, you're more likely to have infection. So any infection floating around in your body, even from dental work that you're having, gets into your bloodstream, goes into your body, and where you have inflammation, infection tends to settle into the areas of inflammation. So you're more prone to getting infections in those areas of joint replacements. Again, PEMF therapy can make a big difference. The only caveat is very, very high intensity magnetic fields, which most people don't purchase, so they don't really have to worry about it. And the highest intensity fields are something like the TeslaFit Pro or the PEMF 120 or Magnawave or the XL Pro, the PulseCenter XL Pros. Those magnetic systems that are out in the community are very high intensity, and they can cause pain in the area of the implant because nerves have been damaged by the surgery, and those nerves are irritated because of the inflammation. The nerves are irritated, and when you pass a magnetic field past irritated nerves, they can flare up and they can say ouch, so they can hurt. But most of the time, PEMFs are going to help you with your implant to make it preserve better, to decrease the inflammation, and extend the lifespan of that joint replacement.